Telehealth is a term that has become increasingly common in recent years, especially as advances in technology have made it easier for people to connect with healthcare professionals without visiting a doctor's office in person. At its core, telehealth simply means the use of digital information and communication technologies, like computers, smartphones, or tablets, to access healthcare services remotely and manage your health. This can include video calls with a doctor, sending messages to your healthcare provider through a secure app, using wearable devices to monitor your health, or even participating in group therapy sessions online. The idea behind telehealth is to make healthcare more accessible, convenient, and efficient for everyone. For many people, getting to a doctor's office can be difficult. Perhaps they live in a rural area far from the nearest clinic, have limited mobility, or have busy schedules that make it hard to take time off work. Telehealth helps bridge these gaps by allowing patients to see and speak with their healthcare providers from the comfort of their own homes. This not only saves time and travel costs, but also makes it possible for people to receive care who might otherwise go without. One of the most common forms of telehealth is the virtual visit. Instead of sitting in a waiting room, you can schedule an appointment and meet your doctor over a video call. During this appointment, you can discuss your symptoms, ask questions, and sometimes even show physical symptoms to your provider using your device's camera. The doctor can then offer advice, prescribe medication, or recommend further tests if needed. For many routine issues, such as colds, allergies, minor infections, or follow-up visits, virtual appointments are just as effective as those held in person. Telehealth isn't limited to primary care. Specialists such as dermatologists, mental health counselors, nutritionists, and physical therapists also offer remote consultations. For example, a dermatologist can look at a skin rash over video, a therapist can conduct counseling sessions online, and a nutritionist can help you plan meals via chat or video. This broadens the range of services available to patients, especially those who may not have certain specialists practicing nearby. Remote patient monitoring is another important aspect of telehealth. With the help of wearable devices or home monitoring equipment, patients with chronic conditions like diabetes, high blood pressure, or heart disease can track their vital signs and send the data directly to their healthcare team. This allows doctors to keep an eye on their patients' health in real time, adjust medications as necessary, and intervene early if there are signs of trouble. This kind of continuous monitoring can lead to better outcomes and fewer hospitalizations. Telehealth also plays a significant role in mental health care. Many people find it easier to open up about their feelings in a familiar environment, and online therapy sessions can reduce the stigma that sometimes surrounds seeking help. Patients can access support from licensed therapists, psychiatrists, or peer groups, all from the privacy of their own home. This can be especially valuable for those living in areas with limited mental health services, or for individuals who feel more comfortable communicating online. In addition to direct patient care, telehealth can be used for education and support. Healthcare providers can use webinars, online classes, or video tutorials to teach patients about managing chronic diseases, taking medications safely, or making healthy lifestyle choices. Support groups can meet virtually, connecting people with similar health challenges so they can share experiences and encouragement. This kind of ongoing education and community support is essential for long-term health and wellness. Telehealth has proven especially useful during times of crisis, such as the COVID-19 pandemic. When social distancing was necessary to prevent the spread of illness, telehealth allowed patients to continue receiving care while minimizing the risk of exposure. Clinics and hospitals quickly adapted to offering more services remotely, and many patients discovered the convenience and efficiency of virtual healthcare for the first time. The lessons learned during the pandemic have helped shape the future of telehealth, showing both patients and providers what is possible with the right technology and support. Of course, telehealth is not without its challenges. Not all medical issues can be addressed remotely. Some conditions require a hands-on examination, lab tests, or imaging studies that can only be done in person. There are also concerns about privacy and security. Healthcare providers must ensure that patient information is kept confidential and that online platforms are secure. Additionally, not everyone has access to high-speed internet or the necessary devices, which can create disparities in who can benefit from telehealth services. Despite these challenges, the benefits of telehealth are clear. It increases access to care, reduces travel and wait times, and can lower healthcare costs for both patients and providers. It enables people to take a more active role in managing their health and makes it easier to get the help they need when they need it. As technology continues to evolve, we can expect telehealth to become an even more integral part of the healthcare system. Telehealth can take many forms beyond video visits and remote monitoring. For instance, some services use secure messaging systems where patients can ask questions or share updates with their care team. Others offer mobile apps that help people track their symptoms, set medication reminders, or access educational resources. Some programs use automated phone calls or text messages to check in with patients, reminding them to take their medication or schedule follow-up appointments. Electronic health records, EHRs, play a vital role in telehealth. EHRs allow healthcare providers to access a patient's medical history, test results, and treatment plans quickly and securely, no matter where the patient is located. This makes it easier to coordinate care among different providers and ensures that everyone involved in a patient's care has the most up-to-date information. Telehealth is also changing the way healthcare is delivered in emergencies. In situations where specialists are not immediately available, such as in rural hospitals or during natural disasters, telehealth can connect local providers with experts in other locations. For example, a small hospital might use telehealth to consult with a neurologist about a stroke patient, allowing for faster diagnosis and treatment decisions that can save lives. For children and families, telehealth can be especially helpful. Parents can consult with pediatricians about common childhood illnesses, behavioral concerns, or developmental milestones without having to bring a sick child into a busy clinic. School-based telehealth programs can provide access to care for students who might otherwise miss out, helping to keep kids healthy and in class. Older adults often benefit from telehealth as well. Many seniors have difficulty traveling to appointments or may have multiple chronic conditions that require frequent monitoring. Telehealth allows them to stay connected with their care team, receive timely advice, and avoid unnecessary trips to the hospital. Family members can also participate in telehealth visits, helping to coordinate care and support their loved ones. As telehealth becomes more widespread, it's important to ensure that everyone can benefit from these services. This means addressing barriers such as lack of internet access, limited digital literacy, and language differences. Many organizations are working to provide training, support, and resources to help patients and providers make the most of telehealth. Policymakers are also considering ways to expand coverage and reimbursement for telehealth services, making them more affordable and accessible for all. Looking ahead, the future of telehealth is bright. Advances in artificial intelligence, wearable technology, and data analytics are opening up new possibilities for personalized, proactive care. Virtual reality and augmented reality could one day be used for physical therapy, surgical training, or even remote diagnosis. As more people become comfortable with digital health tools, telehealth will continue to grow and evolve, helping to create a more connected and patient-centered healthcare system. In summary, telehealth is transforming the way we think about healthcare. By leveraging technology, it brings care closer to home, improves access for underserved populations, and empowers patients to take charge of their health. While there are still challenges to overcome, the potential of telehealth to improve health outcomes and enhance the patient experience is enormous. As we continue to innovate and adapt, telehealth will play an increasingly important role in keeping people healthy and connected, no matter where they are.